Hi guys, I'm Nikki, Lead Vet Tech with Posh. Today let's go over the options that you have when your dog has a CCL tear. So you took your dog to the vet, you've had them diagnosed, make sure you do that. Now what? What are we going to do? So I want to go over some different options, and again, giving a good history to your veterinarian is key. So they might refer you to a specialist. Just remember, going to a surgeon and asking them for non-surgical advice, probably not going to work. What you need to do is be specific. When you go into the specialist or the surgeon, it's totally fine to have a second opinion if you feel that's necessary. If your vet is just not comfortable with the diagnosis, you might have to. Just tell them, hey, I am here. I just want a diagnosis. You can give me the options, but honestly, having surgery tomorrow is not on my list. So that is kind of how I would handle that situation, so that you're not bullied or pushed into doing surgery tomorrow or next week or next month. Don't even get on their surgery schedule until you have done your due diligence and research every option. First option, which seems to be growing in momentum, not necessarily my favorite one, but it's better than nothing, is conservative management. Physical therapy, acupuncture, doing laser therapy, leash walks, kenneling your dog, keeping them quiet, and letting things recover. The issue is this is not for the busy family. If you have little kiddos that can let your dog go outside, then that's not the option for you, because I tell you what, when you have been diligent for 6 or more months and your kiddo accidentally lets your dog outside and they chase a cat or a bird, my dog's a bird, then we're going to have issues, because you're going to come back in, he's limping, we're having a relapse, and you're going to start seeing that cycle. So you see him doing really good, and then they come back limping, doing good, overdo it, come back limping. So the issue with this is it increases the chance of osteoarthritis, because the whole purpose of a brace or surgery is to stop the movement of the knee. So with conservative management, there's nothing holding those ligaments together. So say we have a full tear, that bone is still shifting forward. There's nothing holding it together. So the body is basically forming glue on moving parts. So as you can imagine, it's going to try to stop that movement with more force. If the gentle fibers are not fixing it, the fibrous tissue, it's going to start doing calcification. You'll see a medial buttress form, which is a hard calcification on the inside of the knee. That tells me usually that this knee has been moving for a while, and that it's been going on a while. So again, is this budget friendly? Yes, it's free, unless you're doing PT. But is it the best option for your dog? I don't personally feel so, especially if there's other options out there, because I see so many people come to bracing a year after trying CM. By then we've got possibly arthritis formed, we've got some scar tissue, it's not great, and our knee is just not flexible. So we're almost worse off now than if we had braced right away. Option 2, my favorite, bracing. So with the Posh brace, we're acting as a shock absorber. We're holding that knee together, stopping the tibial thrust or the movement, and we're still allowing range of motion. So things can still move naturally, but we're acting as a shock absorber, letting that scar tissue form naturally. And it takes about 9 months to fully recover with the brace. So with this option, there's not invasive surgery. We can do PT with our patients, and we include 12 weeks of rehab recommendations, and we also can do supplements and lots of good things. So bracing is still under the CM category, so conservative management category. We're just stopping that movement while we're allowing our pet to be normal. They don't have to be in a kennel. They're mentally happier. We're not putting them through invasive surgery. So go for option 2. Option 3, I don't even want to hear this if your dog is over 50 pounds. Your vet should never recommend this surgery if you've got a larger patient. And unfortunately, I see this a lot. I've seen these have to be redone 4 or 5 times, and that's ridiculous. It's called Tightrope, lateral suture, or extracapillary repair. So this dates me a little bit, but back when I graduated tech school, we literally were using fishing line, and and we literally would put it in. You wait 6 months for that scar tissue to form, and you just cross your fingers that that fishing line does not break until that 6-month or 9-month point where that scar tissue forms. So basically, it's the same thing as what the brace is doing. You're holding things together with a fishing line or a suture, and hoping that scar tissue starts to form and that we're stopping that movement. So the issue is it's like $2 to $3 grand. Does it break commonly? Yes. Do a lot of patients with Tightrope have to go back in and have it done again? Yes. Does it have a high failure rate? Yes. So if you're going to do Tightrope, do a brace also. Unless you've got a little teeny tiny dog, they usually do okay with the Tightrope, like a Chihuahua sized dog. But if you've got a medium size or a large size and you're doing this surgery, definitely brace, because you're going to need 9 months of stabilization, and your dog's going to atrophy. That leg is not going to be able to fully weight bear for months with Tightrope, unlike with other surgeries or bracing. All right, last option, TPLO. So I really encourage you, if you're really seriously looking into TPLO or TTA surgery, go online and find Dr. Narda Robinson has a great podcast on the 10 troubling truths of TPLO. So the issue with these surgeries is when they go well, they go well. But when they don't go well, everything goes bad. 1 in 4 patients with surgery have lifelong lameness. That does not sound good. So that's over 25% of dogs that have surgery have lifelong lameness. That doesn't even account for some of the minor issues. And I just talked to a person like an hour ago who had surgery 2 years ago. Their dog is still not fully weight bearing. They have atrophy, and now the other leg has gone, which is a high incidence after doing surgery. So definitely do your homework. Do not get forced into signing up for TPLO or TTA. Again, large breed dogs, like a giant breed, I've seen a lot of complications with TTA, so that shouldn't be as high of an option. Definitely ask. If you have questions, please come to me and ask. But this is very invasive. They literally are cutting the tibia bone in half. They're realigning things, screwing on a metal plate, and that's permanent. You can't undo things. They can take the plate and the screws off, but that bone is now permanently changed and altered. So from a chiropractic standpoint, that doesn't sound very great. So again, my name's Nikki, PoshDogKneeBrace.com, and my email is poshintake1@gmail.com if you want to email me or have any questions. And again, option 2. Thank you. Bye.